Hello, everyone, and welcome back to our next SASGOG researcher interviews. I am really excited to be here with Dr. Alex Peahl, and she is a junior investigator who is doing a lot of really exciting work, and I'm really looking forward to speaking with you today. Dr. Peahl, can you just first start by just telling us a little bit about yourself and where you are and the research that you're doing today?
Yeah, thank you so much for having me today. I'm Alex Peahl. I'm an OBGYN and an assistant professor at the University of Michigan. And right now I wear a few hats. I'm the director of our local outpatient prenatal care program, the Michigan Plan for Appropriate Tailored Healthcare in Pregnancy. I also have a national role with the American College of Obstetricians and Gynecologists. I'm the director of the Redesigning Prenatal Care Initiative, which evolved out of the COVID-19 pandemic. And finally, I'm the visiting scientist at Maven Clinic, which is a digital women's and family health services clinic.
That's a lot of hats.
It is. Never want to be bored.
Yes, it doesn't sound like it. Well, tell us a little bit more about how you got to where you are today with all of these hats and all kind of being on the front lines of bringing evidence in the clinical care. Just tell us a little more about how you got to where you are today.
Yeah. So I've always known that I wanted to work on the health systems level, really from my time as an undergraduate, and had some really formative experiences as I was coming up through St. Louis and Chicago in my training. I worked at this reproductive health clinic called The Spot, which painted the walls lime green, put video games in the lobby, and then had reproductive health services, including the Choice Project contraception available in the back. I then did a Schweitzer Fellowship during med school, which put me in touch with lawyers, social workers, psychologists, in addition to medical professionals from a variety of backgrounds. And it really forced me to think differently about how we deliver healthcare and improve the health of the community. And so I think I entered residency with sort of a different perspective of how we could do healthcare and maybe a little bit more of a curiosity as to how we could do things better. And I was really struck by how many aspects of care delivery just weren't serving our patients. Postpartum pain management was the big one. As an intern, we would send people out the door with 60 tabs of Percocet because that was just what you did. And then as a chief, I was taking care of patients with opioid use disorder, whose opioid use disorder started with their last delivery. I also noticed this in prenatal care. My patients would come regularly for their first visit, their anatomy scan, complete their diabetes screen, and then disappear for a couple of visits, sometimes missing 4 or 5 appointments. And when they came back, we learned that they didn't feel they were getting a lot of value out of those missed appointments and had other life stressors. And so it made me really stop and question how we were doing care in a lot of different ways. And that's really driven my 2 research platforms. I was really fortunate to have great mentorship in residency. Dr. Kristen Madison, who I saw was on your interviews before, really encouraged me to keep asking these questions and think about how to answer them through a research career. And then Dr. Maureen Phipps, who was our chair at my residency at the time, introduced me to what being a health services researcher could be and how someone with my interest could really build a career as a physician scientist. And so on her advice, I applied for and attended the National Clinician Scholars Program, which gave me training in health services research, rigorous methodologies, and health policy, and also introduced me to researchers across the spectrum, internal medicine, dermatology, as well as nurse scientists and pharmacists, really thinking about how other people in health are trying to make things better.
I love that. It sounds like along your trajectory as a clinician, as an OBGYN, you saw these opportunities to ask questions and then take advantage of where there were different opportunities to get more training, dive into the science, and equip you with the tools to take those questions and figure out how do I take this question and operationalize it into research, into something that I can apply to clinical care using rigorous methods. And I love how you kind of piece those things together and it just all makes sense to where you are today. And the next question I have is, I love the health system researcher aspect. If you're our first person has been really focused on that, has talked about that in our interviews. And I think a lot of our SASGOG members might be more interested in saying, gosh, I ask those questions all the time too. And I want to take the next step to advance clinical care for OBGYNs and the patients that we take care of. What would be your advice for those clinicians who are out there saying, gosh, I might want to take that next step on the health services researcher aspect of being a clinician scientist?
Yeah, it's a great question. I think the first and perhaps most important thing is to stay curious and keep questioning why we do things the way that we do. So many things remain untouched in our specialty because they're just part of our day to day. Um, I think prenatal care is the perfect example of that. Until COVID-19, recommendations hadn't changed for almost a century, in spite of all of the amazing technology and changes that we've seen. And I think a great way to do this, and one of the things that we're really well positioned as academic specialists to do, is to bring learners into our environment and really encourage them to question and ask and say, that doesn't quite make sense to me. Um, I think the other piece for me has been bringing new learners into my environment. So I work with a team of engineering students who do industrial and operations engineering. And the kinds of questions they ask are totally revealing. For example, we're trying to model overbooking in clinic capacity. And they asked, well, how many patients can you overbook? How many is too many? And that was never something I had thought about before. You just see the patients in front of you. So bringing in those interprofessional perspectives and really having people who can see things in a new light, I think is critical. The second piece is that there are definitely tangible skills that are really helpful for answering some of these questions. I use a lot of different methods in my work. Where we don't have evidence, I use consensus methodology. Where we have data to be gleaned, I use EHR data or claims databases to dive deeper. And where we really need to bring the patient voice and perspective in, I use surveys and interviews, focus groups. And so I think if you can really target the methods that you need to answer your question, apprenticeship can be a great tool. Often, health services researchers like me are thrilled to have people who want to answer questions and can sort of mentor you through the process. And then, certainly, there are more targeted skill building ways that you can go about it as well.
I love that. I love being able to bring people from other types of professions who all have different perspectives. And I also love how you spoke about that our perspectives as an academic specialist in OBGYN is also unique, and unique in the fact that we can be pretty good, right, at looking at our patients across the life course, across different specialties, different kind of areas that are typically more siloed in medicine. And then also look outside the box to, oh, well, this silo, let me break outside this silo and bring in this person from engineering or other areas, just like what you spoke about. I love that capability. And I also love how you spoke about how we have the tools, right? You can get those tools, you can get those methods. And as an academic specialist in OBGYN, we can bring all those things together and make things work. We might not necessarily need, the $10,000 piece of equipment, right, in our lab to be able to take evidence and translate it into clinical care. We can do it with the right support and mentorship and using those tools that we have at our disposal. I love that.
Yeah. And our lived experience on the front line of healthcare makes us so uniquely positioned, as you're saying, to ask and answer these questions in the best way possible.
I completely agree. Well, the last question I want to ask you for our interview today is a little bit more about what is your favorite part of your research? What is the favorite part of your role as a physician, also doing research? And just tell us a little bit more about that and where that is going in the future for you.
Yeah. So I think one of the really unique aspects of my research recently has been bringing people from different backgrounds, different parts of the country together to bring their perspective into care development. This has been most obvious in the prenatal care redesign work that we're doing. So we used consensus methodology to develop new prenatal care guidelines, but recognized that the community voice needed to be part of new recommendations. So I've been conducting focus groups with almost 100 people from 25 organizations, really learning what are the barriers on the ground, what do people want out of their care, and what do the people who are taking care of our patients need to make that possible. We've done that in several ways through surveys and having rich qualitative responses. I got to do some incredible human-centered design interviews in Detroit, spending 90 minutes with pregnant people who face some really challenging barriers to care and hearing their resilience and navigating those, and then translating all of that into something actionable that can be useful for patients and, again, the people who take care of them, is one of the most rewarding parts of my job. And what's in the future? Well,
what's going in the future? I love it.
Like any early career researcher, I'm going through the grant writing and iterative process that is challenging but rewarding, exciting to bring a new forward. We're continuing our work with ACOG and are really excited to release new national recommendations, which will provide a huge opportunity for implementation science and understanding what it means to get these on the ground and into people's hands. And so lots of work on how to take that from paper to practice.
I love it. And your work is so exciting. And I really appreciate you taking the time to tell us more about your work, your trajectory, where you're going next, and a little bit more about how you bring people together to, again, turn our evidence into clinical care. I think if I had to take one word from your interview today to end us on, it's the word actionable. I love how you said that and how you are an example of how we can take research and be actionable in the moment, especially throughout COVID-19 and the pandemic and the work you've done, truly actionable in the moment when we really, truly needed it. So thank you again, Dr. Peahl, for your time today. And we appreciate it. And for all of our listeners, thank you for listening. And we look forward to seeing you for our next SASGOG researcher interview.